Hey guys, my name is Mandy Torres, and this is my final presentation on the evaluations of technology and information literacy competencies for the family nurse practitioner in our healthcare delivery systems and information technology course in the spring of 2025. Competency number one talks about integrating appropriate technologies for knowledge management to improve healthcare. The overview of this competency is simple. It's just saying that nurses showed their technology skills by effectively using tools and resources that are going to improve patient care, facilitate communication with other health professionals, and allows them to stay up to date in the advancements of the healthcare by using technologies along the way to help keep these skills up to date. What methods are used in order to demonstrate this competency is nurse practitioners that employ electronic health records, manage medical equipment, and utilize advanced technology. And this allows facilitation of remote patient monitoring and telehealth services. So current practices in education that support competency number one. I broke this down into the educational goal that we were looking to meet within this course. And for competency number one, it's appropriate technologies for knowledge management. Current clinical practice that I use right now is I use electronic health records, specifically MyChart and Epic. I use digital clinical reference tools as up to date to use resources to figure out what's best practices for post-op surgery cases. Telehealth is actually a big one in my role because I do all my preoperative screenings via telehealth, going over instructions for pre-op, cleaning, for total joints, medications and things along that line. And I also use electronic communication with professionals and patients simply by using secure chats to relay information among my coworkers and within different departments. Educational competency completed through this course. Demonstrating competency number one is a case study that we did addressing public health concerns related to surgical site infections. I demonstrated this by showing that I need to use up-to-date tools to create care plans for the patient. Electronical communication I talked about, and intercollaboration and how important they are for addressing public health concerns. And I did talk a little bit about telehealth potentially for follow-up appointments for a larger population to talk to surgical patients following the implementations of what I predicted would be helpful. This slide just talks about future practice goals to enhance my skills in competency number one. So first is advanced education. So I plan on obtaining a certificate as a certified perioperative nurse because that's just going to highlight my proficiency in the surgical domain. Number two, I'm going to become a certified telehealth provider, and I'm going to aim to integrate telehealth into my regular practice, particularly for follow-up appointments, managing chronic conditions, and assisting patients in the rural or unserved communities, such as where I live right now. And I'm going to keep up to date with my telehealth platforms and make sure I adhere to the HIPAA practices and enhance patient engagement strategies. Number three, lifelong learning. I'm going to pursue continuous education in healthcare technologies, focusing specifically on informatics, data analysis, and cybersecurity. This is going to allow me to enhance the safety and effective application of practice for my patients. And number four, enhance patient education via technology. I plan to utilize digital resources such as patient portals and online materials. And to do this, and with doing this, it helps to boost health literacy and empower patients through their healthcare experiences. And these are all things that will help heighten my ability and strengths to complete competency number one. Competency number two is translate technical and scientific health information appropriate for various users. Specifically, assess the patient and caregiver's educational needs to provide effective personalized healthcare. So basically, this is for FNPs. They have the ability to effectively communicate technical and scientific health information, um, but they tailor it to the needs of the patient and, or excuse me, the needs of the audience. FNPs are really good at this, so they target their audience. So, like family members, patients, healthcare teams, using a variety of different communication techniques. Strategies for patient communication involve simplifying complex medical terminology, right? We all learned that very early on in our career that medical jargon doesn't work for patients. Utilizing the teach back method to evaluate the patient's comprehension and the use of a standardized tool to assess educational needs are all methods that allow FMPs to assess educational needs. In order to provide information effectively among healthcare providers, communication techniques include employing precise clinical terminology, using those evidence-based practice guidelines that you read about, and utilizing electronic health record documentation, clinical summaries, or collaborative care plans to effectively reach the different healthcare workers. Healthcare literacy is really huge for this specific competency. So FNPs, they need to understand each patient's level of health literacy, and then they need to tailor their educational needs based on their specific patient. Current practices and education that support and demonstrate my abilities for competency number 2A. So again, the educational goal here with this course was to effectively communicate technical and scientific health information by tailoring a presentation to different audiences, including patients, families, and healthcare teams. Currently, in my clinical practice, I do this by explaining diagnosis, medications, and procedures to patients in a clear, non-technical way, basically a way that they can understand it. For example, when answering questions about any surgical procedures and diagnosis, I just think how to explain it in a way that a patient would understand. So instead of saying, "Oh, you're going to get a laparoscopic cholecystectomy," I, say something like, "This involves using a small camera to remove your gallbladder." Intercollaboration is really big among my clinical current practice. So I use electronic health secure messaging to facilitate post-op x-rays within the imaging department. We get patients who got total joints and they need to receive post-op x-ray to make sure that the hardware is in there correctly. And then educational competency completed and demonstrated for number 2 is when we made that educational infographic to promote the use of artificial intelligence in the surgical center, right? We had to show that, technology is changing and AI is beneficial to the patients and within the team itself. So I had to tailor my presentation to be appropriate for my clinical setting and my coworkers. Future plan practices to strengthen my competency skills include using secure messaging and asynchronous communication. So I'm going to use platforms that's going to allow my patients to message me at any time, and I'll have clear timelines for responses and integration into their records. So I can use these conversations and things like that to assess the patient's level of understanding, and also giving them an opportunity to reach out to me to enhance their understanding about something if they're confused. Number two, structured interviews/surveys. I'm definitely going to be using some standardized tools to assess literacy, preferred learning styles, and cultural consideration into the patient intake, just so I can understand how my patients learn, if there's any considerations as far as their culture goes, things along those lines. Number three, personalized patient education models. This one, I'm going to use actually multiple, right? I'm going to combine some verbal explanation with some visual aids. We're going to do written materials. And the important thing here is that most of my written material has to be at appropriate reading level, which is usually 6th to 8th grade. And also, I'm going to use videos um, that have evidence videos and different forms of these educational methods that have been shown to be evidence-based that enhance patient understanding. And number four, resource development. I'm going to utilize mobile apps, patient portals, and digital media to reinforce key messages in the way that are accessible and trackable for both the patients and other members of the healthcare team. These mobile apps and patient portal things are going to allow me to understand, is the patient understanding what I'm telling them they need to do? Are they following up on doing their food diary, things along those lines? And then I can also use these to develop post-op educational pieces that I keep seeing among patients. I can use these apps and things to make universal understanding for patients. Competency number 2B, this is the ability for the FMP to translate technical and scientific health information appropriate for the users, specifically coach patient and caregivers for positive behavioral changes. Overview of this competency is that FMPs, they're going to use evidence-based coaching methods to help patients just adapt and modify their behaviors. You're going to assess the patient's understanding and educational needs and present information in a clear and accessible way and guide the patient or caregiver towards desired change through education, support, and encouragement. So how do we get through this competency? What methods do nurse practitioners use? FMPs are going to employ motivational interviewing. It's just allows for building of intrinsic motivators, and a rapport among the patient and the provider. They're going to use goal setting that is smart. So we're going to set goals for patients that are specific, measurable, achievable, relevant, time bound, and positive reinforcement with, with those regular follow ups to track the progress and adjust the plan. Because we're not going to know if things are working unless we're setting those smart goals and we're following up and we're making sure that things are working like they are supposed to. Family caregivers are encouraged to be involved in motivating positive behavioral change. A nurse practitioner can utilize technology to guide patients and caregivers towards behavioral changes by providing remote support education and monitoring through telehealth platforms. So this can include like virtual coaching sessions, personalized health apps, and self-monitoring devices. All these are designed to improve and empower individuals just to take a more active role in their health management. Current practices in education that support competency number 2B. Again, this course, our educational goal was to use healthcare information technology to encourage our patients for positive health changes among patients and caregivers. So in my current clinical practice, I use electronic health record systems to document and share personalized pre-op and post-op care instructions. I conduct telehealth and virtual preoperative counseling And I do this to enhance patients' understanding of the surgical instructions. And also, this provides an opportunity for any preoperative questions to ensure that the patients are coming into our OR fully equipped and ready to go. And then educational competencies. I've demonstrated these through assignments showing the ability to develop patient planning using electronic health records and public health records. Personal health records, to create strategies that enhance patient education and communication, which ensures their involvement and protects their privacy. I showed these competencies through the week 3 application to practice and also week 3's blog. Future practice plans include personalized patient education models. I'm going to continuously improve my discharge and aftercare instructions for better understanding, and this is regardless of the individual's health literacy level. I would like to see myself develop a discharge instructions using evidence-based practices to create a universal instruction so a broader range of patients can understand the material presented to them, and it can be appropriate for all levels of health understanding. Number 2, enhanced education. I'd like to see myself complete certifications in motivational interviewing or health counseling. Number 3, intend to use personalized patient motivational approaches. This is so in order to do this, I would like to use like a approach that's brief. It's focused on motivational interviewing during the preoperative assessment or for post-operative rounding to address fears and support behavioral changes. And then number 4, implementing behavioral change models into my practice. I plan to incorporate these models such as the trans theoretical or health belief model as a resource to assess and encourage patients to modify their behavior based on their surgical requirements, whether that's pre-op or post-op. So an example I'll use, and I see quite a bit, is like giving proper diet to improve symptoms of diverticulosis. Competency number 3 talks about demonstrating information literacy skills in those complex decision making. So the overview is that FNPs, they're going to exhibit information literacy skills during those complex decision making cases by effectively identifying information's needs, finding credible resources, evaluating the quality of evidence, and then applying that information to the patient care. That's a big one for this competency. And how are we going to do that? We're going to assess multiple data sources, including research findings, clinical guidelines, and patient history. And after we do this, we're going to make sound evidence-based decisions off of that. FNPs are going to use the electronic health records, clinical decision support systems, telehealth platforms, and AI-powered risk assessment tools to just help make informed decisions in complex cases. Current practices and education that support competency number 3. Again, educational goals we were looking to achieve here is to use that health information technology to exhibit information literacy skills during complex decision making. In the OR, I demonstrate these skills by utilizing technology to collect, analyze, and use essential data in real time. Electronic health records I rely on quite a bit, and evidence-based clinical decision-making tools, such as surgical checklists and timeouts to guide the best practices and reduce the risk of complications. I examine patient history, lab results, and past surgical notes just to guarantee a comprehensive understanding of the patient's conditions before and after the surgery. And then educational competency completed. I evaluated the credibility of information related to mobile health technology to create a thoughtful plan for a complex congestive heart failure patient. I did this by utilizing educational databases to gather evidence-based information to help share a comprehensive treatment plan, which you can see that demonstrated through week 3 application to practice. Future practice plans include utilizing clinical decision support systems. I'm going to enhance my proficiency with these CDSS and remain current on the newest CDSSs to manage complex medical cases. Evidence-based tools. I'm going to incorporate evidence-based tools and practices into my work because simply these resources impact patient outcomes and, provide solutions for complex cases. I will use UpToDate and DataMed to ensure the most current practices for my patients. This is a fun one, I think. Simulation of complex cases, right? I'd like to see myself like form a team of professionals who collaboratively present, analyze challenging cases. These mock case reviews, they stimulate complex case studies with real life approaches. And then number 4, enhanced education. I'm going to enhance my information literary skills and applied practices by completing targeted continuing education courses, focusing specifically on clinical reasoning and chronic disease management. Competency number 4, it talks about contributing to the design of clinical information systems that promote safety, quality, and cost-effective care. FMPs, they play a vital role in shaping how clinical information systems are applied, and they do this by using frontline experience, clinical expertise, and patient-centered approach in the development process. How do we get to this point? What methods are used? FMPs are going to support the integration of evidence-based guidelines into the clinical information systems to enhance patient outcomes. Basically, FMPs, they become clinical workflow experts, right? They gain insight into the entire patient care process, and this starts from intake to follow-up, which allows and enables the design of systems that ensure intuitive and clinically relevant workflow. FNPs identify areas susceptible to documentation errors or communication, and by doing so, this enhances patient safety and reduces errors. Current practice and education, that's going to support competency number 4. Educational goal here, we were looking to learn how to effectively contribute to the design of clinical information systems that promote safety, quality, and cost-effective use. In my current clinical practice, I ensure smooth communication among the pre-op, intra-op, and post-op care teams, and by utilizing secure chat through the electronic health record system. Basically, we will use this system to navigate from one OR to the next, saying, Dr. O'Keefe says you can head back with the next patient, or go ahead and give the eye drops for the next patient, things along that line. I specifically established a dedicated group chat for the interventional radiology and OR departments to improve post-op recovery because we handle and take care of IR post-op patients. So this secure chat has allowed and facilitated communication and better outcomes for recovery. Educational competencies completed here. When I thought of this competency, I instantly thought about the previous leadership and health policy course that we took. That really has shown me the FMPs lead change to the clinical information systems. And I've effectively demonstrated these skills through the assignment working within the HIMSS health patient motto, which was week 1, by using secure messaging between patients and providers, integrating the patient-generated data into the electronic health systems, all while promoting online quality, safety, and patient care. Future plan practice includes staying up to date with healthcare information technology. I plan on using electronic health records, clinical decision support systems, and telehealth platforms to develop secure care plans and facilitate communication between my patients and other healthcare providers. Number two, regulatory compliance. This one was actually left a big impact on me during our readings and assignments on regulatory compliance, right? And how I have to be familiar with essential regulations and standards in the healthcare industry, like HIPAA, because this ensures patient privacy is protected and it ensures that the information is gathered and transmitted correctly. Number three, cost-effective measures. I will conduct comprehensive cost-benefit analysis for clinical services to assess the effectiveness and cost of the practices that we're doing. We don't want to be doing something in the OR and realize that it's not cost-effective or simply it's not working at all. I plan on utilizing surgical platforms to optimize efficiency and productivity in the operating room. And then number four, collaboration. So collaboration, I plan to will serve as a significant factor in my practice. I intend to work closely with healthcare professionals, IT staff, and other stakeholders who are engaged and involved in developing clinical information systems to help facilitate the implementation and the designs of these systems. Competency number five, using technology systems to capture data on variables for the evaluation of nursing care. The overview of this competency is that it talks about nursing informatics, and nursing informatics utilizes technology systems to help capture, manage, and analyze data that's going to be pertinent to the nursing practice and patient care in your clinical setting. FMPs are expected to be well trained and knowledgeable in the use of technology systems to improve care. How are we going to use this? How are we going to get these methods completed? So this involves combining nursing science and information technology and to identify, define, manage, and communicate data information, knowledge, and wisdom in nursing and using nursing technology platforms such as electronic health records, point of care devices, clinical decision support systems, and data analysis tools. Current practices and education that support competency number five. Again, the course goal here is to engage in creating and refining technical information systems that basically boosts and enhances patient safety, elevates quality of care, and facilitates cost-effective treatment through the use of technology. Current clinical practice that demonstrate this skill is reviewing my patient's medical history, allergies, lab results, and surgical consents. And I do this just to guarantee that there's a thorough and precise pre-operative assessment. And this minimizes the potentials for errors from the pre-op to the post-op phases of surgery. Educational competencies demonstrated was specifically in week 2 blog assignment because this demonstrated the importance of how nursing informatics and healthcare technology improve patient outcomes and show how to use technologies to advance care. Future plan practice to enhance skills and competency number 5 includes staying up to date with healthcare information technology. I'm going to use electronic health records, clinical decision support systems, and telehealth to make secure care plans and just facilitate communication, intercollaboration among healthcare providers. Data mining for quality improvement. I'm going to obtain clinical data from health information systems to identify trends and engage in initiatives to enhance data-driven decision-making in my nursing practice. Number 4, data analysis. I tend to use the data analysis with electronic health records to predict risk factors associated with surgical procedures, data analysis with patient characteristics, medical history, and potential outcomes. And this is approach is aimed to identify the most effective treatments and interventions while optimizing operational efficiency. And then number four, participate in evidence-based practicing using electronic health record data. So collaboration, again, is going to serve as a significant factor in my practice. So I tend to work closely with healthcare professionals, IT staff, and other stakeholders involved in developing clinical information systems. And then final reflection. Looking back and reflecting on, has this course changed my outlook on how I explore and discover health informatics? And the answer is yes, absolutely. This diving into this course has really enriched my understanding of how technology influences modern nursing and patient care. And if I'm being honest, at first I just thought informatics was mostly about data entry and electronic charting. But since taking this course, it's really opened my eyes to the fact that it's a broader impact on enhancing clinical decision making, boosting patient outcomes, and promoting evidence based practice. I now look at nursing informatics as a vital tool for advanced nursing practice. And reflecting on why it's important for a nurse practitioner to be informed and proficient in health informatics, this course has really enhanced my understanding of health information technology, from utilization to ethical considerations and everything in between. I learned that informatics enables FMPs to access and analyze real time patient data, enhance clinical decision making, and care coordination among providers. FMP should absolutely obtain and integrate informatics into their daily practice simply because it enhances patient care, and utilizing health information technology strategies have been shown to be effective. That is my presentation. I hope you guys enjoyed it. Thank you.